Hey guys, this is Jay Patel from MyFitMed. Today we'll talk about some of the common medications that are used to manage the side effect of testosterone replacement therapy. One of the common side effects is elevated estrogen level. And the medication used to lower the estrogen level are estrogen blockers. Commonly, we use anastrozole or Remidex. We use tamoxifen, or also known as Nolvadex. These two medications helps you lower the estrogen level. The second common side effect is testicular atrophy or lower fertility. So the medication used to improve this symptom is either HCG, which is a sub-Q injection. You can also use Clomid, which is oral medication, and the newer medication that we have seen improvement is enclomiphene. All three medication has similar effect. It stimulates your testicle to naturally secrete more testosterone, improve your sperm count, and improve your testicular atrophy. And also, if you are one of those patients that have elevated hemoglobin level while you're on TRT, along with donating blood, you should also start taking baby aspirin. If you have any question, give us a call, give us a thumbs up, and subscribe for more videos.